Love Your Prostate Episode 2, where we discuss treatment available for BPH. Hello and welcome to Love Your Prostate, the layman's guide to BPH. My name's Dave and I'm your host. BPH stands for Benign Prostate Hyperplasia, and it basically means you've got an enlarged prostate and it is not due to cancer. Just want to stress that, it's not due to cancer. Now I want to start off by clarifying a few things. I am not a medical person. I have had no medical training whatsoever. But I do have BPH and I've had it for a number of years, and I therefore feel qualified to speak about it as a layman. Number two, this channel provides information and no more than that. The views are mine and mine alone and should not be taken as being medically correct. Bear in mind, this is the layman's guide. I'm just a layperson. I am not a doctor. Number three, never change your medications without first seeing a healthcare professional. And number four, this is the important one. If you're watching this video because you have problems with your waterworks and haven't seen a doctor, it's really important you do so immediately. The chances are it was nothing serious, but if it is cancer related, you need to get treatment as soon as possible. With early treatment, the outcome is usually very good, but delay at your peril. Remember, early diagnosis, early treatment, good outcome. So please see a doctor without delay. Okay, now that's out of the way, we can get on with video 2. In this video, we're going to discuss all the options to treat BPH. That's the options that I know of. There may be new ones out there that I'm not aware of, but I'm constantly looking on the internet to see what there is available. I'll do all this research for you so you haven't got to bother. Now, if you haven't watched episode 1 of Love Your Prostate, I strongly recommend you do, because episode 2 is just a continuation of episode 1. In fact, I could have put them both together, but it would have just been too long, so I split them up into episode 1 and episode 2. Episode 1 will give you a really good grounding understanding of BPH, benign prostate hyperplasia. It explains in layman's terms the workings of the male urinary system and how BPH affects it, and I go into some detail to explain it all. So I think once you've watched that, you will understand a lot more about BPH, probably far more than the doctors ever told you. Okay, so we'll assume you've been to the doctor, you've had the various tests, PSA test, finger up the bum, and you've been diagnosed with BPH. Well, on the face of it, it's actually quite good news, because it could have been an awful lot worse. So having known what you've got, it's now a question of learning how to deal with it. Doctors always seem to start you off on a tablet medication, probably because your symptoms aren't that bad and it's the cheapest way of dealing with things. Obviously, you don't want to go straight into surgery when you don't need it. Here in the UK, which is where I live, there's two main tablets that they seem to use. One is called tamsulosin and the other one is called Flomax. Now they might both be the same tablet, I'm not too sure, but these are the two names that they use for this particular kind of medication. Basically, it's an alpha blocker. Now, alpha blockers are used extensively for controlling blood pressure. So just bear that one in mind, right? They're used to control blood pressure. This particular one, to the best of my knowledge, isn't. It's used to control BPH and BPH alone, because it just affects the muscles round by the urethra area. And what it does, it relaxes those muscles, and it just makes it easier for you to wee, basically. And I did try these. I tried these, 30 odd years ago when I first started having my problems. And to be fair, it did work. My stream did improve and things were a little bit better. Yeah, the whole thing did work pretty good. But one big downside, it was the side effects. And all these tablets that they used to treat BPH with seem to be full of side effects. I think maybe because they're alpha blockers. Don't really know that. But it's just the side effects. No matter, when you research this, you find loads of people say the same things, couldn't get on with the tablets. So the side effects I had, and bear in mind everybody is different, right? But I had a dry mouth, very dry mouth, anxiety. I'm a very positive person, so for me to be anxious is virtually unheard of. But it wasn't very nice. See, even driving my van about for work, I was anxious all the time. It just wasn't great. So I thought, I can't be doing with this. So I kicked them into touch, and I haven't been back on the tablets since. So that's Tamalosin and Flomax. So, and I haven't been taking tablets since, and my symptoms have gradually got worse. There's no getting away from it. But you know what? I'm not that bad. I think I must be one of the lucky ones. So, yeah. So there we go. So another medication that you're liable to be prescribed, and this really is one that's prescribed by consultants. I've never known a doctor to prescribe this, not to say they don't, but consultants, obviously, they're more up on their game. We'd expect a consultant, a urologist, to know exactly all the ins and outs about everything. Bear in mind, a general doctor is what the term says, a general practitioner. He's not a specialist in anything. He's just a specialist in bits and pieces of everything. So I saw a consultant, gynecologist, urologist. Sorry, not gynecologist. I'll strip that bit out. I saw a consultant urologist fairly recently, and he said to me, "There's another tablet we can use, and it's called finasteride." And he was full of praise, and I think he wanted me to go on this medication. And he said to me, it can actually shrink your prostate back to where it was about 20, 30 years ago. Well, that sounds good. So, so I did what I always do, and that is I went home and I researched it. And after researching it, I thought, no way, Jose, I'm not taking this tablet. Now, for some people, it may work really good. I didn't use it, so I can't really say yes, it does, it don't work, I don't know. But when I read up on the side effects, I really didn't like the sound of it at all. One of the side effects, well, not so much one of the side effects, but it seems like it's one of these tablets where once you go on it, you have to stay on it for the rest of your life. And I couldn't actually find out what happened if you did come off it. And I thought, well, I don't like the sound of this at all. So I didn't go on it. Didn't bother with it. So you're probably wondering, well, what do you do? What's your treatment for BPH? Well, I take a herbal medication, stinging nettle root powder. And this is what I use. And I put a teaspoonful of that in a small amount of water. And I take that every day. And I've been doing it for about a year now. Now, I've got to tell you, it smells like mud, if you've ever smelt mud. If you've ever tasted mud, which I never have, but I'm assuming this is what it would taste like, it's bloody horrible. Nevertheless, get it down you. And I've been drinking that now for over a year. And I have to say my symptoms haven't got any worse. And if anything, they've slightly improved. So I think there's something in this. So that's the medication that I take. So there we go. I think we've now covered all the medications, and shortly we're going to talk about the surgical measures. Now we come on to the surgical procedures that you may be offered. Now, unlike when I was first offered a TURP procedure 30 odd years ago, there are quite a few different options out there today, and I'll explain the most common. Number one, TURP, which stands for, now get ready for this, transurethral resection of the prostate. The name alone frightens the life at me. It gives me the right heebie-jeebies. Now, they've been doing this since the year dot, and it is still carried out widely today. It's probably the most common procedure for BPH. It's considered the gold standard by which all other surgical procedures are judged. Unless it was absolutely necessary, I would not have this procedure. It's a major operation. It's an invasive procedure. You need to be knocked out, and you have to stay in hospital. It was a very bloody operation, and it probably still is today. So if you're on blood thinners, it's definitely no good for you. Basically, they cut out lots of the prostate. So look out for my video on TURP for an in-depth understanding. So that's Love Your Prostate, BPH TURP Explained. It's on the channel, ready to be viewed, as you can learn all about TURP. There's also similar systems to TURP. They do the same job but by different means. They use lasers to do a similar job. HOLEP, HOLEP, which stands for Holmium Laser Inoculation of the Prostate. Developed in the 90s, is considered to be minimally invasive. Once again, you'll be knocked out or maybe a spinal. I think the main difference between this and TERP is that the laser can seal off blood vessels, meaning less bleeding. Green light laser is another one. It's similar to HOLEP in that it uses a laser, albeit a different type of laser. I think it's actually a green laser beam. And it's considered minimally invasive. So I'm going to cover all three of these, TERP, HOLEP and green light, in the TERP video. So look out for the TERP video. The laser methods do seem more patient friendly. Now we move up a level in medical expertise and we take a look at aquablation. This treatment, although its end result is a TERP, is far more accurate and patient friendly. It deserves its own video and it will be available shortly. So that's Love Your Prostate Aquablation. Another surgical procedure available is one called REZUM, REZUM. Once again, the end result is a TERP, but it's the way they get to it. Right, we're now going to take a quick look at ITIND, that's spelled ITIND. Now this really is a different sort of procedure entirely. It does not perform a TERP, but places an implant into the prostate to open up the channel, or the urethra if you like. It's quite clever and it's totally different from all the other methods. Once again, it deserves its own video, so look out for it in Love Your Prostate ITIND. Urolift, this is another totally different procedure, spelled EUROLIFT, Urolift. Another totally different procedure to everything else we spoke about. It involves using clips to open up the prostate. Once again, it does not end up with a TERP and is patient friendly, not patiently friendly, it's patient friendly. So once again, I've dedicated its own video to it because there's a lot to talk about. So once again, Love Your Prostate Urolift. Another procedure is called Echo Laser, ECKO. Echo Laser, I'm sure that's how you pronounce that one. I really like the sound of this, minimally invasive, patient friendly, and a totally different way of achieving the desired results. It's kind of a TERP, but it isn't. And I think it's very, very interesting. This might well be one of the best ways to go. Not totally sure yet. Look into it in more detail. It's got its own video again, so look out for that one. Love Your Prostate Echo Laser. Very interesting. Another way of dealing with BPH is catheters. Now, you probably never considered this. It's not right for everybody, but it could be a really good option for a lot of people. It's a great way of living with BPH without having operations and all this kind of stuff. So, this once again, the catheters have got their own video, so look out for that one. As I said, Love Your Prostate. Love Your Prostate catheters. Right, well that's it for the surgical procedures. As I say, they've all got their own separate videos, and of course the three TERPs are all lumped together. So you're probably asking yourself, well, what do you do? What treatment do you have? Well, I use a herbal supplement and it's called stinging nettle root powder. It definitely doesn't work for everyone. And my symptoms have not got any worse. If anything, they've got slightly better. I'm quite happy with it. I can live my life quite happy the way I am as things stand at the moment. Once again, it has its own video because there's quite a bit to talk about with herbal remedies. There's a lot out there. You know, some work, some don't. Some are just a lot of crap. You have to just, read it up and see what you think. Well, these are all the different methods I know of dealing with BPH. So, yeah. Well, that's it for now. If you found the video helpful, please subscribe to the channel, and if you could like the video, just hit that little thumbs up sign. It'd be great. What that does, it tells Google that the videos are worth watching, and it promotes them. If I don't get many likes, then no one's going to see them. And the whole idea of this channel is to help fellow man. So please, if you've got anything out of these videos at all, please hit the little like sign and subscribe to the channel as well, and you'll be notified when there's new videos coming up. And I'm doing this research all the time. I never stop. Crazy, isn't it, really? But yeah, there you go. Things we do. Oh, and there's one other thing as well. If you live in the UK like me, you'll be pleased to know that some of these treatments are now becoming available on the NHS. So if your consultant says you need a TERP, you go and see a consultant and it says, oh, you need a TERP, that'll sort you out. You will be in a position, after watching all these other videos, which I spent a lot of time researching, to help you out, you'll be in a position to say to him, what about all the other options, consultant? And this is guaranteed to throw the consultant. He won't like it. So make sure you have them all written down so you don't forget any. It's possible you may be able to get the treatment you want from another health authority if your one doesn't do it. I don't know how that works, but I know some different health authorities do different treatments. Well, I think we've covered most of the things here. So I wish you well and sincerely hope the videos help you in your decision making. Right, now I've had to put the lights on down in the cabin because it's getting rather dark outside. I've been here so long recording this, it's taken ages. Now, the last thing I want to talk about is in episode 1, if you've watched episode 1, I refer to a problem I had with my waterworks after a total knee replacement. I haven't scripted this at all, so it's just as it comes out, right? So we'll make the most of it. Now, I had this total knee replacement and it was great, it's brilliant, one of the best things I've ever done. Unfortunately, after the operation, my bladder just refused to work. I couldn't pass wee, or just little bits and pieces. So after day 2, and I was coming out of hospital the next day, still no improvement. So a catheter was inserted because basically I had urine retention, which is what you get if you get BPH really bad. You just can't pass a wee. And had I been at home and this wasn't due to a total knee replacement, I'd have had to gone to A&E and had a catheter inserted. And basically what the catheter does, once that is pushed up through the penis, it's a little tube that goes through the penis, through the prostate, into the bladder, and just drains out all the urine straight into a bag. So happy days, you feel fine and all the rest of it. And I came home like that with this catheter in. And I was really worried. I thought, God, I'm never going to be able to pass wee again. This is bugging me right up. Well, it hadn't. And just bear this one in mind. Having researched things, I found out that this is not uncommon at all with anaesthetics. Now, I had a spinal. Whether this adds to it or not, I don't really know. But I had a spinal, so it's where they stick a needle in your back and numb you from your waist down. So I'm guessing that numbs everything, prostates, bladder, the lot. And I've been told that the bladder is quite a lazy muscle, so perhaps it just takes longer to recover. Well, cut a long story short, after about 2 or 3 weeks, my bladder did get back to normal. And the catheter comes out, and happy days, I'm great. So, yes, I just bear that one in mind. I just wanted to waylay those fears that if this ever happens to you, and I know it happens to loads of people, and when you research it, you can't find much information about it. It's not a permanent thing. For most people, it is not a permanent thing. So don't be frightened to have a catheter put in. In a way, I think I should have had a catheter in straight away after my operation, but no, I'm not a medical person, so what do I know? So you have to go along with what they tell you. But I will say another thing about this. After having that catheter in, and consequently once it's been taken out and all the rest of it, it's as though it reset my bladder to a degree, and my symptoms didn't seem quite so bad. Most strange, I know. And it was at this point that I started taking the herbal medication, stinging nettle root powder, which I've already mentioned earlier. Well, that's it from me. I've only got one more thing to say, and that's love that prostate.